And then around 3 years ago, myself and two other clinical colleagues started a company called the Medical Consulting Group. And really the aim for that was to try and get the voice of clinicians and other health experts into startups and other health tech companies early in their product cycle, and to try and increase the success rate of early stage health tech startups, both in the UK and globally. I probably got first involved in health tech in 2017. And at that time, there were a small number of very large businesses in the market, the big electronic patient record systems, and there were not many early stage health tech companies that actually, and particularly there weren't many early stage health tech companies that had clinical founders or people in their sort of a core team. And vice versa, there wasn't a lot of receptiveness in the health industry for startups. Now that has changed massively.
So what's the one piece of advice that you want to give them?
I think the world doesn't need lots of small point solutions. It needs some big solutions that actually make a big difference at scale.
Hello everyone, welcome to another episode of Tech Finds Tech. Today we are joined by the incredible Thomas Maggs. He is the founder of Medical Consulting Group. So thank you, Thomas, for joining us today.
Pleasure. Looking forward to it.
All right, Thomas. So before we dive into the questions, if you could just quickly introduce yourself for the audience and just tell us about your background and all of that thing.
Perfect. So I'm Tom Maggs. I'm a pediatrician by background. Worked in the NHS for 10 years, still do some clinical work, but very much been full-time in health tech for the last 7 or 8 years. Initially transferred out as a sort of chief medical officer / clinical lead role, so mostly clinical, and then transitioned into more product and operations roles and held as a general manager and then chief operating officer role for a health tech startup. And then around 3 years ago, myself and two other clinical colleagues started a company called the Medical Consulting Group. And really the aim for that was to try and get the voice of clinicians and other health experts into startups and other health tech companies early in their product cycle, and to try and increase the success rate of early stage health tech startups, both in the UK and globally. So we've been running the business for 3 years now. We've got a big network of about 1,500 clinicians and health experts that we match with businesses, everything from small projects to larger things. And it gives us a really good insight of the market to be able to work with both the sort of the actual businesses and understand what their stresses are, but also a lot of the frontline clinicians and actual managers to be able to understand what their problems are. So it gives us a very unique central position on both fronts, I think.
Perfect. Sounds good. And from your introduction, what I've understood is that you've basically transitioned yourself from medicine to more of a technology kind of side, right? So what inspired transition from a clinician to basically an entrepreneur?
So I think some people have a eureka moment that they think that this is there's one thing and they've always drawn towards entrepreneurism. I think if you'd have asked me 5 years ago or 7 years ago, I would have thought that I would have just been practicing medicine and very routinely. There wasn't something early on that was a big driver for me. I got involved in some projects part-time, so initially just outside of clinical hours, and I was looking probably for something else to stretch and be a bit different than the clinical workspace. So particularly pediatrics is quite system-led, as it should be, so it's very much a sort of 24-hour-a-day service. So that means that there's not a lot of room to sort of move outside of your clinical sort of guidelines. So the first thing that really drew me to technology in the health tech market was actually the ability to work on some longer term projects, and actually be able to see things tangibly change. And the really exciting bit was when I started to work in some digital health apps, and you started to be able to have some ideas on a Monday that potentially could be deployed on a Friday onto a live version, was something that actually, really got me excited about the space. And then I transitioned out pretty gradually. So initially did 2 days a week for a year, then went to full time, and then actually left my sort of training post in medicine about 2 years after that. So I think some people have to make a big jump sometimes and really leave in one go. I think I was very lucky in the fact that actually I got to dip my toe into tech, enjoy it, and progressively sort of improve my skills over a period of time, until the end of it actually realized that this is what I wanted to do as a career path later on.
Perfect. Sounds good. And what gap in healthcare collaboration were you trying to solve when you founded the Medical Consulting Group?
Yeah, so I think one of the big areas that we've seen in a number of different health tech companies is that actually it's easy to get access to some clinicians, but very difficult to get access to the ones that you really need. And what we'd seen is businesses sometimes build products that might be 2, 3, 4 years down their product life cycle, and
Mm,
actually then found out that it wasn't going to fit into
true.
the clinician pathway, it wasn't going to fit into patient pathways, it wasn't going to fit into what government plans were for the next 4 or 5 years. It's a difficult scope because potentially if you're using heavily regulated products, you've got to build something, you've got to decide to build something 2 years in advance, build it, and then start to sell it as well as evidence it in that period of time. So our first real aim was to try and get the voice of clinicians and health experts into those businesses right at the beginning. And we do that because we've got a big network, it means that we can do that in a relatively cost effective way. We can do that
Mm,
in really fractional ways. So our interviews, workshops, I say like focus groups, everything sort of up to sort of more longer term advisory roles, and give people different perspectives. So yeah, the big thing sometimes is as well, different clinicians have very different perspectives, and clinical practice is different in different parts of the country, in different size hospitals. So what we do is actually make it easier for people to speak to a
all right.
range rather than just speaking to one big London hospital and then not understanding what life's like in Carlisle or in Lincoln, is a big, big difference. So that's one of the big things that we try and do.
Hmm. And while researching, we thought that your model of connecting startups with clinicians is quite unique, right? So what does effective clinical collaboration actually look like in practice?
Yeah, so I think the first bit is the right people, and then the other bit is that the right people who have the right attitude. So firstly is skills. So does that person have the experience? Not, over a time being clinicians ourselves, it means that it's easier for us to break down actually what people are looking for. Sometimes on the business front, people come and everybody wants to speak to their professor of so and so, but actually they might not be doing the legwork or the day-to-day role that your tool potentially might then be being used by. So whilst
Yep.
it's useful to speak to, say, some people with all of the experience, actually getting a mix sometimes is really important. So firstly is the niche area. And then I say the second one is around actually working with clinicians to find the ones that you think are open to collaboration, who have the type of mind to be able to say, oh, actually, I can see that tool working here. We'd need to shuffle these few things around, or have you thought about how that would fit into this work pathway, or that this is connected with this. And we've been really lucky over the last year. We placed over 300 clinicians over the last 2 years in roles, and
Hmm.
some of those have given such invaluable advice. And the honest truth as well is that a lot of the clinicians who get involved in it love it and really enjoy the process of being listened to by somebody externally who actually really wants their opinion at a granular level. So I think that's
Yep.
the big part. It's the matching what the businesses actually need from an insights point of view, and then from the clinicians finding the right clinicians who are actually going to be really open to the process.
All right, perfect. So, while I was researching, what I liked really about you that you've seen both sides of the coin. You've worked on both sides of the ecosystem, whether it's healthcare and technology, right? And we work with a lot of healthcare products as well, but the founders are not basically from the healthcare side; they're more from the business side. So, what kind of challenges or surprises you face on both sides of the ecosystems?
Yeah, I think there's in a good way. I think both systems are in a better place than when I first got involved in health tech, which is I probably got
Okay.
first involved in health tech in 2017.
Mm-hmm.
And at that time, there were a small number of very large businesses in the market. The big electronic patient record systems, and there were not many early stage health tech companies that actually, and particularly there weren't many early stage health tech companies that had clinical founders or people in their sort of a core team, and vice versa. There wasn't a lot of receptiveness in the health industry for
Okay.
startups. Now that has
Mm-hmm.
changed massively. So
Yes.
there was a view again 6, 7 years ago that all startups were just trying to make money out of the NHS and that they were just they were coming with the wrong reasons. I think a lot of people have adapted to actually, technology can have really good benefits, and some of the frontline staff have seen that in action. So the first thing I would say is like the ecosystem is much better than it used to be because there are more clinicians who have crossed over and worked in health tech, and there are more health tech businesses that have progressively, launched products that have actually been successful. But there's still a long way to go. There's still a lot of people, I say, on the, as a doctor as well, and to be honest, like there's a lot of people who sort of turn their nose up at some technology saying, well, is this actually going to help me? I've seen lots of things, you know,
Yeah.
electronic notes actually made my life harder, not easier. I spend less time with patients now. So there is still a concern from that side. But I think one of the big bits, so what we try and do, but also actually the industry as a whole, is actually getting those people into a room and getting more people to have worked in both sides has made a huge difference to how things have been run.
Yeah. Sounds good. Yeah, I think that makes sense. So the $1 million question nowadays, with the rise of AI, the AI bubble right now in startups and products. So with that rise, what trends do you see, and what kind of technology do you see integrating into the healthcare region, or as we talk about the everyday care? So how do you see that, and what's your opinion on that?
Yeah, so I think there's layers to health, and one of the biggest, probably easiest way to think about that as either a clinician or a non-clinician actually is how regulated are those areas. So you've got a big layer before any regulation where there is a huge administrative burden, both on hospitals, on general practices, but also actually on the patients. You as a patient to navigate your own care requires a huge amount of calling at the right time. Did you follow up about this? I've not got an appointment around this. Who do I ring? And then vice versa on the back end of the hospital systems. There's a huge amount of administrative work. People are still, until very recently, people are still faxing results. People are still paging each other in hospitals. There's a lot of infrastructure and administrative that
Hmm.
is prime for improvement, and that is coming through at the moment because those products are unregulated, because they're not in a sort of patient-facing aspect. You've seen the earliest improvements, and there is already tools being used on the back end for a number of those. the
Yeah, yeah,
the biggest difference that people are going to see front facing is in AI scribes and not taking direct notes. So many GPs, over 50% of GPs will have this deployed in the UK already. So in a year period, you've suddenly gone from telling people this might be deployed to deployed in a very, very short period of time. That that it's not necessarily going to be the world's biggest difference. I think it will make a huge difference on time, but I think the biggest thing is that will be the bit that both patients and clinicians see so visibly. It will change how appointments are run. It will change how clinics are run. It will change the allocation of timing of an appointment. All of those things are suddenly you're changing the infrastructure of how we've been delivering appointments in a way that we
hmm,
haven't changed the structure of for 50 years. So I think from a tangible route, it may not necessarily lead to all the biggest medical improvement, but from a tangible route that patients and clinicians will see, that will make the biggest difference. And then the final bit that I think is really interesting that's coming in over the next, which really hasn't touched the surface yet, is the more highly regulated clinical decision support. So one of the big things that we've got an issue with in health in general is actually we have an enormous amount of data points, but they
okay,
need to be interpreted by the individual clinician almost every time they sort of see a patient or make a decision. And the honest truth is that it's just not possible. If I've
yeah,
got a patient who's got 50 previous attendances, I can skip through some of their information, but my ability to go through all 50 with depth and be able to find out, what their social interactions were, what their blood results were, and all that, it's not possible. And so,
yeah,
because of that, we as a pattern recognition humans, actually, we're leaving huge amounts on the table there that could be really useful. So the ability to summarize that and then support in decisions, I think is that's where we start to think about things like highly regulated medical devices, and there's a few that are coming to the market, but their lead time takes 2 to 3 years to go through for a type 2 or above. So you're talking about something which is going to take, there is a lag on, AI raising money and working. You're not going to see those clinical products until 2 to 3 years down the line. And I think we're starting to see the first of those, which I think is
yeah.
the really exciting bit that patients might not see, but they may well see the change, the improvements of.
All right. So, in your experience, what basically distinguishes healthcare's health tech solutions that truly improve patient outcomes from those that simply sound innovative?
Because I think the biggest two are integration. So, rightly or wrongly, the system is built on a backbone of electronic patient records and other sort of tools and medical devices that really lock everything together. If you're not
Mm,
integrating new solutions onto that, and if you're not building something which actually is large enough to solve a significant problem rather than being, a single solution, only solving a small problem, I think it's really difficult. So I think what we're seeing is you need to almost bite off enough of take a big enough bite of the market to be able to actually build something that somebody's going to want to buy and integrate. And then, because if you're a GP practice or a hospital, you do not want 1,000 different small tools that can add up. You need them to be a few that are going to be able to cover everything. Um, and then the other really big bit is actually, does this tool, it might, in an isolated world, make a really big benefit to, into this area or this condition, but actually, does it work into clinician workflows? Does it work into patient flows? Does it actually fit into the current system? And then the
yeah,
final one, sadly, is who actually is going to pay for it. And
right,
I think
right.
we've seen that really with the AI scribe situation earlier in this year, is that, actually it's been a big situation of, is this going to be paid for at national, like regional, local, like, or individual practice sort of level. Um, that is a really big thing. So some of these products that are going to come to the market, they might be making a big difference, reducing number of patients in A&E, say. That's great. That might then reduce the costs on the hospital in other areas, but are they the sort of person who's actually going to directly pay for it if the actual tool might be delivered in general practice, say? So
Mm,
the payment aspect is something which can't be overlooked, and is an issue globally. So it's about lining up sort of government policies and things aligned with some of these tools. And if the tools aren't, and the business owners aren't vocal or forthcoming or trying to find solutions to that, then they won't work either. So
all right. So last question for this section would be, what do you think? What role clinicians will be basically playing in the next generation of AI powered health tech solutions or health tech systems?
yeah, so the first is, the hope is that you'll have the ability to be able to interpret much larger data sets and use those sort of collision tools to mean that you can make a much more holistic approach to a patient. The second one is, the hope is that you will get more time back with your patient. So I don't know the exact stats, but the GP appointments is that the average GP appointment, it's a 10-minute appointment, but you might get 3 to 4 minutes with your actual GP, and the rest is note taking or time or on the average appointment. So the answer is that if we can maximize some of these things with AI, actually do you get more patient time? That's the hope. It might end up with just more patients being crammed into clinics, but there is the opportunity that actually we could be giving patient and human interaction back. And bearing in mind, as good as an AI is, it's never going to be able to break bad news or tell somebody they've got cancer, or it's we're not at that point. That there's a compassion and an empathy element in medicine which isn't going away, and the requirement for humans to be involved in that, I don't see going, in our lifetime, even with very, very good quality AI, and even with very empathetic AI at the point of
Yeah.
service. There's certain things where clinicians are sort of are going to be further involved in that. Um, and lastly, unfortunately, the biggest thing really is a lot of these tools are coming on the market and being used. One of the difficulties is actually understanding how you're going to manage the sort of post-market surveillance and seeing that these tools are actually handling themselves. And I think the clinicians are going to have more and more of a role in that front. So, an example of this is, people are using, this might not be a digital tech, but people are using 3D printed knee replacements now.
Mm,
Well, that's
yeah.
great, but that means that you might need one surgeon in a department actually to still remain doing the original knee replacement, because otherwise you're not going to be able to train the trainees on how you do anything without a 3D
Yes.
printed knee replacement, and vice versa with a number of other areas. If you remove these things from training, how do you actually train future clinicians and others? So we haven't really answered that question yet, and it's specific to certain, to different specialties, but actually, and it's not a problem which is just in health. you know Law firms, accountancy
Yeah.
firms, they
Yeah.
used to run on a system which early stage, um people in the business just did the sort of donkey work or leg work, that's
Mhm.
that work it probably isn't going to be there anymore. So there is a point to say, how do you train people in the modern world? And I think the clinicians, there's still a huge need for top end clinicians. How you keep getting people there is this sort of hidden answer of how clinicians are going to be able to still be needed to support, the AI delivered aspects of care.
Makes sense. All right, let's move to the rapid fire questions. The trick is you don't have to think too much. You just have to just answer whatever comes to your mind. So my first question will be one technology that you think that will redefine healthcare probably in the next 5 years.
Yeah, I think the AI scribes first up is that's going to change that interaction. You as a patient, and I think it's going to take some getting used to, and I'm not sure everyone's quite ready for it from a patient point of view. Is that suddenly you're going to be having a conversation, and everything you're going to be sent a letter immediately straight afterwards with a summary of what you've said, what you've got. So I think that's the biggest one from there, is that you're going to see that live changing the way that we actually interact with patients and clinicians, and that's going to be in the next 6 months, let alone the next 5 years.
Yeah, true. Yeah, true. And one health tech company or health tech system that you have that has inspired you or that you have looked around, what would that be?
So the one at the moment I think I'm really impressed with is a company called Sonome, who are a sort of digital twin or a predictive company of emerging risks. So the reason why I'm interested in them, if I was talking about those levels of unregulated or administrative, lowly regulated, and then highly regulated decision tools, they've
Mm,
set a path for reaching class 2 medical device status, so a highly regulated tool, and then being able to raise significant money out on the back of that. So I think the good side for that is, rather than in a choppy VC market where there's where people don't want to invest in things that are going to make money in the long term, they want things that are going to potentially be revenue generating short term. Actually, to have a few trailblazers ahead that are raising money is going to encourage more businesses to take that heavier regulatory but potentially larger impact, bigger risk, bigger reward pathway. So that's really, I think, exciting for us as an industry to see UK based business do that.
And so if we talk about like everyday life, what role of AI do you think is very exciting or will be exciting in the upcoming months or years, as you said?
In health or in general overall?
General, like everyday life, like
Yeah, I think again we've gone through a very long. My hope from that is at the moment we live in a world where we're overloaded by stimulation,
yeah, it's true.
and that be everything from, particularly if you're running your own business or in any work environment, you've got 5, 6, 7, 8 different points of contact where people are reaching you, and a phone that's immediately able to engage with those. I think one of the bits moving forward is, actually, can we move towards a world where that's funneled and streamlined in a way that actually it's much more approachable to yourself. The phone's brought it all to you when you want it, but unfortunately also it doesn't come in a systematic way. And so I think one of the big things we hope from a personal point of view is talking about individual productivity or all those things, and actually just standard of living. My hope very much is that the AI systems that are available and the integrations mean that you can have a much more streamlined management of your attention, because at the
Mhm.
moment the world is a war for your attention, and your attention is worth more than anything else. I think the pushback to that is, some of the tools, whether it's through mobiles, whether it's through other tools that you can use to actually start to refine what that feels like, and actually what are you using your attention on. So that's the hope, and I think there's a lot to say that that's what people are trying to move towards. you know Even Apple's like new tools, which potentially like voice only, or sorry, ChatGPT's new tools potentially voice only and no screens aspects to the that type of AI interface. I think that's where we'll see how progressive that can be.
And one question that I ask usually everyone is what's the one piece of leadership advice that you have received and that has really helped you in your company as well?
I think the biggest piece of advice in managing a team or managing anything is that you don't need to be best friends with everyone. I think particularly when you first start in management, you think you do, but you do need everybody's respect. And I think that's the biggest difference, and that's the best piece of advice I think that I could give, particularly to new leaders, because everybody tries to be best friends with everyone first. But
Yeah,
actually, the respect is far more important than that from both sides.
that is actually very insightful. Um, so what's the future of healthcare look like? Especially, let's talk about the UK or the UK in general. What does the future of healthcare look like over there?
In the UK, so the UK are in a good position on a number of different bits around health tech. So one of the big things is that actually there's a relatively small number of software solutions that are deployed in the UK, which means that
Hmm.
integrating with them is easier than other systems that are potentially much more fragmented. There's large buyers. There might not be a lot of capital spend money, sadly, but I think that's something which is going to be coming across many nations rather than just the UK. So there's not a load of money for digital solutions up front, but I think if you can prove that they've got genuine return on revenue, which I don't think is a bad thing that you have to. So I think the benefit the UK has got is by having a heavily integrated system, the ability to roll out tools that work at a mass scale actually is probably one of the most prime markets. And if you look at companies that are growing outside of the UK, a lot of them choose the UK as their second market. So a lot of the digital health solutions come from Sweden, Latvia, Estonia, smaller
Yeah.
countries there, or even Spain or even Australia. And a lot of those companies will say, right, we're not going to go to Germany, which is a bigger market next, or we're not going to go to America because that's its own separate beast, really. We're going to go to England second. And so
Hmm.
it might not be the world's biggest cash maker for some of those businesses, but it can actually give you very effective testing. It can give you very good results. So it's still from the health tech space, still has a very big place in I think the world. And there's also no change that actually English is still a massive language globally,
Yeah.
and the fact that you can deliver it in that language is a real big bonus for a number of companies, particularly where they've started in a different language like a Scandinavian language, and actually to go English second is part of their sort of roadmap. So we really benefit from that side. I think the real bit around health is there is a squeeze, and there's going to be a squeeze globally around costs and actually the delivery of care. Unfortunately, we
Hmm.
probably can't keep growing at 10, 12% growth in costs over that period of time. So that is going to mean you're going to have a restructuring of how care is delivered. The hope always, and everybody talks about it, is like, can we do more preventative than not? The problem with that is with sort of short-term political systems, it's very difficult to invest in that and see the rewards 10, 15 years down the line. Um, but I do think that there is a movement and going to be a movement toward more patient-led care, and actually the clinicians being have slightly more of a bystanding role, that they interact when they're sort of receiving care rather than what has been delivered over the last 30, 50 years, which actually is doctors own everything. You as a patient almost should be thankful that we're spending the time looking after you. I think that that world has gone, and I don't
Sure.
think it's coming back in any time soon. And to be honest, it shouldn't. So I think there's just a shift in general, and this is happening specifically in the UK, but it's definitely happening in other countries as well, where actually we're empowering. What we don't want, and what's the scary point from all of this, is that we don't leave behind people who are vulnerable as we empower the ones who actually are able to sort of advocate for themselves in care. So it's that two-sided point, but I think that it's a very positive point that we're sort of putting the patient at the center of care in a much better way.
Hmm. All right, perfect. So before we wrap this up, Thomas, if you could, what's the advice that you want to give to the young entrepreneurs who want to work in healthcare? Uh, Again, with the buzz of AI, there's a lot of emerging entrepreneurs trying to work in different domains, and again, going to start building products and raising funds and all of that. So, what's the one piece of advice that you want to give them?
I think the biggest point for mine would be to think big enough. So I think one of the biggest pieces that's happened over the last sort of 5, 10 years is that because people have been worried about raising funds, they've sort of chipped away at what their core offering actually is to make it revenue producing earlier, or to make it a smaller piece of the puzzle. I think the world doesn't need lots of small point solutions. It needs some big solutions that actually make a big difference at scale. And so that really means, unfortunately, that reduces your chance of your startup being successful, but increases the chance that it might be even bigger when you get there. So I think when it comes to health, yes, there's lots of smaller solutions which can be great, but really, if you think you're going to go into it and you really want to commit a number of years to it, don't dull it down and try and take a small, a small share. This is very much trying to
Mm,
deliver to millions of people. Take a big enough bite that you think actually what you're going to do is going to help millions of people rather than a few thousand.
perfect. Thank you very much, Thomas. It was an insightful session, to be honest, for me as well. And thank you, everyone, for joining in and seeing the podcast. And hope we'll see you in the next one. Thank you very much.
Thank you.